Good evening, I'm Dr. Akl. I'm a radiation oncologist in Flint, and today I will speak about the main advantage of radiation is preservation of the function of the organ, and it's important to know if this organ is tongue or nose or external genitalia, either vulva or penis. Last session I talked about cancer of the penis and how successfully treated with radiation with excellent chance of cure and good sexual and urinary function. Now I'll speak on vulvar cancer. Vulvar cancer traditionally treated with radical vulvectomy that result in removing essentially the entire external genitalia and leaving only small orifice for urination, and the patient lose their sexual function and psychologically became down. Recently, myself and Dr. James Graham from Hurley Medical Center published one of landmark paper on combining upfront radiation concurrent with chemotherapy cure vulvar cancer in 90%. And our paper is landmark paper standing in the literature together with other papers. Showed similar results. 90% or so of 90% of patients with vulvar cancer will be cured with radiation with preservation of the vulva, and the patient have normal sexual and urinary function. Vulvar cancer is slightly more common than penile cancer, and we see it more often. That's one of the reasons we were able to publish our data. If patients do not push for alternative treatment for vulvar cancer, they will end by radical vulvectomy and this big surgery, which is not wrong. It cures cancer, but equally effective is radiation therapy when it's combined with chemotherapy. They get locally over 5 to 6 weeks. This vulvar cancer is gone, and the patient keep their sexual organs and normal sexual function, normal urinary function, and that's very important for patients. Patient need to be a driver in this cancer, and they need to ask for alternative treatment to their cancer. They need to be seen by a radiation oncologist, otherwise they will go for surgery. Unfortunately, there is less understanding on how effective radiation in curing cancer, even among cancer specialists. Radiation is a very narrow area and is branching every few years, and because of excellent results, many patients became aware of the effectiveness of radiation, and they ask for it. As a matter of fact, for cancer of the penis or vulvar cancer, usually patients do not want aggressive surgery, but they ask for alternative treatment, and they feel very happy after they are treated and cured from their cancer with preservation of the function of their organ. During radiation treatment, patient experience skin irritation and gnawing, especially towards weeks. Usually those patients require 5 weeks of radiation. In case of vulvar cancer, 1 treatment a day, 5 times a week for 5 weeks, and for 6 weeks in case of cancer of the penis. Patients, because vulvar cancer require concurrent chemotherapy, they start to experience side effects early. These side effects essentially in the skin irritation. The skin is erythematous, and annoying. We give patients special creams. Good news is once those 5 weeks finish, within two weeks to 1 month, skin acute reaction disappear and the patient go back gradually to normal, and the cancer in the majority of cases disappear in more than 90%, and they live normal life. Late side effects, which is scarring or thickening, we don't see it today. With good radiation, which we have the good technology today, and we pinpoint our treatment to our target volume, and the dose is homogeneous, so we see less late side effects, or rarely we see late side effects, and the patients, at least those we treated and published, they have excellent satisfaction from this type of treatment. In summary, radiation treatment for organs like the vulva, tongue, penis, highly effective as a primary treatment. Main advantage is preservation of the function without compromise of cure. The literature is rich of data to show how effective this treatment in terms of cure, cancer cure, good function, and patient satisfaction is excellent. Side effects, early side effects is temporary. Once patient complete the course of treatment, within couple of weeks to a month, these side effects disappear, and the patient gradually gain normal life activity. Late side effects do not occur, and if they, in the majority of patients, if they occur, and that consists of thickening of the skin, and we don't see it today simply because of more precise delivery of radiation than 10-15 years ago because of the good equipment. This treatment for vulvar or cancer of the penis need to be patient driven, because radiation is not known to many physicians and not known to even specialists, and a specialist in radiation need to talk to the patient and explain to them the benefits versus side effects, potential cure, and so on. Then patients need to decide whether they need to have radiation or surgery or any alternative treatment. It's so important that these side effects are explained to the patients, as well as options of patient treatment. And the literature is there, and patients have this literature, and it's so easy to understand it simply, or if patients require it, it is in the internet, and patients will get good results. Cancer treatment is a team. We normally decide for the best course of the patient, but the patient also need to ask and demand for alternative treatment to ensure all options are presented to them, and they did the decision they like to have. Pros and cons of each treatment will be explained to them, and patient will be happy.